So as Dr. Adams had mentioned, this particular document is the Preventing Sudden Death in Secondary School Athletics. This kind of set the foundation. And just going to remind everyone that this was released back in 2013. And then for 3 years, that would be 2015, 16, and 17, the KSI worked with the American Medical Society for Sports Medicine and the National Athletic Trainers Association to bring together the entities from all 51 states, including the District of Columbia, to try to move these policy changes forward faster. So this document set the stage. Then we worked with individual states as they reached out to us, but then we also held a national meeting every March. Very ironically, the very first meeting was here in this particular room, where we brought representatives from all of the 51 state high school athletic associations and the sports medicine advisory committees. And then the second year was at the NCAA headquarters in Indianapolis, and then the third year was in Kansas City. All right, so this was the template, as Dr. Adams just mentioned. I also just want to mention where a lot of this data comes from. The National Catastrophic Center for Sports Injury Research is a research consortium housed at the University of North Carolina at Chapel Hill. Corey Stringer Institute is one of the partners of that research, as well as the University of Washington. And this is where we investigate all catastrophic deaths that happen in sport so that we can track how policy changes influence safety and hopefully preventing death. So I want to make you aware of the connectivity there. So the particular health and safety policy ranking, I want to just give obviously a reminder that the primary goal, just keep running to remind everyone, our goal is to try to eliminate preventable deaths in sport. So as Dr. Adams just mentioned, 4 causes of death are over 90% of all the deaths that happen in sport. That's the most important statistic I have for you today. Okay, 4 causes of death are over 90% of all the deaths that happen in sport. So we obviously wanted to focus on how to modify policies to address those 4 particular medical concerns. So remember, the ultimate goal of everything we do is to try to eliminate preventable death. So to remind you, these are the 4 leading causes of death. All right, we have cardiac, heat stroke, head injuries, and exertional sickling. All right, so I'm going to talk about these here in a second. So the leading causes of death when we're talking about cardiac, if you have AEDs available within 2 minutes and you have training and education on how to utilize those, the evidence indicates that more than 90% survival if you do those 2 simple things. All right? And cardiac is the leading cause of death in sport. So 2 simple items can eliminate over 90% of the cardiac deaths. When we're talking about exertional heat stroke, immediate recognition, immediate cooling with cold water immersion, and cooling on site before transport, those 3 elements have shown remarkably to have 100% survival in over 2,300 heat strokes that we've tracked. So this is one of the most toughest things that I deal with as a professional when we have people die from exertional heat stroke, because really simple methods can have someone survive an exertional heat stroke, and extremely cost effective. We're talking about a $150 tub and ice and water, and every high school in America has ice and water, so we're talking about purchasing a tub. I'm just going to give you a really great story last week in the Southeast, okay? They had KSI in a month ago to overhaul some of the policies for about 30 of the high schools that were serviced from a particular high school, a particular hospital. And they did that, and they updated to best practices for their particular policies. And last week, they had a football player go down with an exertional heat stroke, and the athletic trainer immediately did a rectal temperature and found out the person was 108 degrees, had him immediately started cooling with cold water immersion on site. They had a tub ready to go and cooled on site until they were down to 103 degrees, and then had the ambulance was there on site, obviously, when they were done cooling, and then transported them to the hospital and completely recovered, that they didn't even have to spend a night in the hospital. All right, I'm showing you how heat stroke does not have to have long-term complications, or even, obviously, not person dying from the condition, with very simple methods. But if you're hot for more than 30 minutes, if you're over 105 for more than 30 minutes, it's very likely that you'll either die or have long-term complications. So I'm giving you an idea of something simple like that. The third one here is head injuries. The things that are listed there. make very simple strategies. One example is Heads Up Football, which is an educational program instituted by USA Football, which works to promote safe tackling, safe blocking, also educates on other important safety issues like equipment fitting and heat illnesses and cardiac issues. That evidence indicates that can dramatically reduce the incidence of concussions, for instance, and other head injuries in sport. The last one is exertional sickling, that might be the least familiar to all of you. Exertional sickling is when someone who has sickle cell trait has what we call a sickling crisis during intense exercise. And simple modifications, like finding out if someone has sickle cell trait, the NCAA has proven can dramatically reduce deaths from exertional sickling. They still can do the sport and do activity, but just some very simple modifications can reduce risk. So my point is that the 4 key causes of death that we have shown, the evidence shows that policy changes work. For instance, cold water immersion saves lives, AED save lives, knowing if someone has sickle cell trait or not saves lives, having an educational program to prevent head injuries reduces the incidence of head injuries. These are simple and cost-effective. The policy rankings I'm about to show you right now, we believe that you can get to 85 points out of 100 for less than $5,000 a year. Okay, so you can have a very, very, very strong score with very minimal cost. So this is not something that's a crazy expensive policies that we're talking about. So I want to just show you, just as an example, some of the different states that you see right here. So we look at the leading causes of death that are in sport. So we have cardiac, heat stroke, head injuries, healthcare coverage, and emergency preparedness. My point of showing you this particular slide is that you can see that in some of the sub-discipline areas that we looked at policies, some states have perfect scores. Like here you can see Massachusetts and New Jersey for cardiac. You can see heat stroke, that some have strong scores. Same with head injuries and healthcare coverage. My point here is that it's clearly attainable. If you can achieve, you can do quite well in these policies and procedures. Many states are already showing that in sub-discipline areas. So now it's a matter of rallying everyone together to have all of the particular policies. So what I'm going to do now is go through the particular rankings. This is officially released at 10 o'clock today. And as was mentioned before by Dr. Adams, it's going to be the Orthopedic Journal of Sports Medicine. Is going to be public access today as an open access journal and be published in the September issue. But going from 25 to 1, you can see here Alabama, New Mexico, Florida, Pennsylvania, and Virginia. And you can note the scores here. I'll talk about the range in a few minutes. If we go from 20 to 15, you see District of Columbia, Texas, Arizona, Tennessee, and Illinois. From 15 down to 11, you see Oregon, West Virginia, Mississippi, New York, and Arkansas. I want to just point out, too, that we're very proud that 6 of the top 11 states we've worked extremely closely with over the last 7 years of the existence of the Korey Stringer Institute. One thing to also point out that, unfortunately, many states make massive policy changes after they have a death in their particular state or have a series of tragedies. So we're trying to institute a policy of do whatever you can before they die, to not have to wait for your particular state to have an emergency or a tragedy to implement the policy changes, to maybe learn from a tragedy that happens across the state line and institute the policies yourself. But a lot of the states did react in a very positive way after having the tragedy and to try to prevent them from happening in the future. Here you can see from 10 through 5, Georgia, Wisconsin, Hawaii, Washington, and Missouri. And then in the final 5, our top 5, South Dakota, New Jersey, of which we have Dave Salon is one of our speakers today, who has worked tirelessly with us and with his constituents in his state, and he'll talk about today. Massachusetts, Kentucky, and our #1 state in the ranking for high school health and safety policies in the review that occurred in June of 2017 is the state of North Carolina with a score of 78.75. And we have a representative here from the state of North Carolina to talk about some of the efforts they've made through the years to make this kind of positive change. I recently spoke with a good friend in North Carolina who's been working on policy changes for 15 years there, and he said to me, he's like, why are we not at 100? He's like, I'm going to work my butt off now to try to get the last 21, and I 2.5 points that we need, and not just worry about that we're ranked number 1, but there's obviously still some room to grow even for the state that's ranked number 1. So I just wanted to show you some of the state ranking quartiles. I'm not exactly sure why you see in the Southeast and in the South and in the East tend to be some stronger scores. It might partly be due to the much higher risk of exertional heat stroke in many of those states, and some more high-profile deaths that they've had, and that things that can be done quite simply to make those modifications. But I just wanted to give you a little bit of a regional profile. And you see up the top there, the lowest score was 23. The highest score was 78.75, which I think what's interesting here is that you can we didn't have a rubric that everyone had 98, right? That there wouldn't be much room to grow. We didn't have a rubric that everyone had a 3, that it's obviously not very attainable, the things that we have in the rubric. We have a rubric that clearly, if we have somebody near 80, that most of these things are attainable. And the interesting thing is that at least one state has every single point in the rubric. So some state is doing every single element. So it's just a matter of now trying to get more people to do these particular policies.